यूज फॉर 4 पेशेंट फ्रॉम 1 पर्सन. 2 आंख में से 4 पेशेंट का फायदा हो जाएगा. कैसे? This I am showing little magnified, where this is a cornea, full thickness. The thickness of the cornea is about 1 millimeter. अपना जो cornea का जो thickness है, it is 1 millimeter. So certain patients का क्या होता है? The opacity is only superficial. खाली superficial layers of the corneas are involved. खाली आगे का जो layers है ना, only उधर ही opaque है, अंदर का transparent है. तो ऐसे patient होते हैं. In this patient, what we do? Only the superficial layers of the cornea we take out like that. ऐसे ही diameter का ही होगा, but only a superficial layers of the cornea. That means उसका thickness will be less. Similarly, the donated eyes का भी superficial layers of the cornea we take out and put it here. Similarly, और एक patient आया जिसका superficial layers अच्छा है, उसका deeper layers are involved. So what we do? Only take out deeper layers. This is very difficult surgery. Actually, खाली deeper layer निकाल के उसको पीछे से ऐसा डालना most difficult. In Mumbai, hardly people must be doing. 1 or 2 doctors must be doing. So, this only the deeper layers of the cornea are taken out, and the donated eyes का deeper layers of the cornea are put. लगेगा दूसरा patient को लगेगा. But the new technique which is come, which can really help 4 people and interrupted. There are so many deaths, millions of deaths, but the eye donation is very less. And the blindness goes on increasing every year. It is adding actually to the total number. And we are really not getting any eyes. So many people are blind actually. They are just waiting for corneal grafting. So very important not to burn. We have to be alive. Even next janam में आपको जिंदा रहना है तो it's better to and very important अभी क्या है, new techniques of corneal grafting is come, where you know normally if we donate eyes only 2 patients are benefited. एक आंख एक patient को irritation for the patient after the grafting of the cornea. Irritation means yeah, थोड़ा सा रहेगा. That's the reason. Only for about 1 to 1.5 months. And if there is much foreign body sensation, then we take out the sutures little earlier. That's the reason continuous sutures are always better than after the grafting. It's like that. The cornea, if the cornea has got an opacity which is white absolutely, then there is a total blindness. The patient will not. That means it's partial. थोड़ा clear area है, थोड़ा opaque है. You know where through अच्छा area में से उसको थोड़ा सा दिख. See, if the उसको ऐसा दिखेगा. You understood ना? Like that.
The corneal blindness is not total blindness. Totally blind.
एक सुचर लिया, नॉट किया, दूसरा सुचर लिया, नॉट मारा, तीसरा सुचर लिया, ऐसा अलग अलग सुचर्स करके हम लोग नॉट मारते हैं. But in that what happens? There are so many knots. So patient can have that typical foreign body sensation, redness, watering for months together. इसमें only one knot is there, that also is buried. That knot we can bury it inside and there is no foreign body sensation at all. This is what you see if we are blind, hazy all. Instead of that, if we can see what we are seeing, such a beautiful thing we are seeing with our eyes which God has given us. जो blind है वो यही सीन को ऐसे देखेगा. So when you do keratoplasty, you are going to take the sutures. So this is a continuous sutures, you know. Once एक बार suture लिया तो continuous sutures. These are also continuous sutures. Interrupted sutures में एक corneal grafting whenever you do. The other name for corneal grafting is keratoplasty. So I told you the causes of blindness, most common infection, injury and surgery. This I told you about that. See, here is the opacity. You can see the central corneal blindness. This is a mostly congenital. This is a mostly hereditary. This doesn't appear like that. this is mostly, it is because of corneal dystrophy. This is a hereditary disorder. The child is born with the opacity. Because this is a typical central part which is affected. Hereditary. Understood? Because whenever we are doing, we can't see whatever is going behind. We can just do some investigation and find out. Put on this. So this blindness is important. But even the cornea mein opacity, if it is there, and when you are operating, you are supposed to tell the patient that if there is any retinal problem, optic nerve problem, you may not see. The cornea. This cornea is important for your corneal blindness and for eye donation, whichever cornea we take out. This is about the corneal blindness in India. 1 million people are blind in India, out of which mostly are children. Children. 50% are children. This is just... Children means less than about 14 years. 12 to 14 years. This is just to show the diagram of the eye, where just wanted to tell you that only you can put 7 to 8 days and you can do the surgery. So I'll just show you. Actually, I have got one CD, but that is not functioning. So what you asked me the question, idhar ka thoda sa bhag aisa teda meda hoga, we are not worried. Very important, the cornea when you are removing, it should not get damaged. When you are removing the cornea, it should not get damaged, and whatever you have taken out, immediately you are supposed to put in a bottle having saline with antibiotics, and you are supposed to close it, and this bottle you are supposed to take to the eye bank, keep in the fridge for 4 degrees centigrade, and you can keep for about 48 hours. And within 48 hours, if any patient is there, call the patient, and then you can do corneal grafting. Suppose within 48 hours the patient is not there, and then what to do? You can put in some media. One media is known as MK media, where you can keep for 7 to 8 days, right? And then we used to close the lids. So it used to appear like eyes only. But it is, nowadays they are doing this. And after doing this surgery, what I am saying, this is the latest, they put the contact lens on this. This I am talking about. When you do this surgery, only part of this is taken out. So you put the contact lens on this, so it appears like cornea only. Soft contact lens is put on this, so it appears like cornea. It appears like eyeball. सब नॉर्मल ही दिखेगा, किसको मालूम ही नहीं पड़ेगा कि आपने कुछ किया है. You understood this part? Ma'am, I just wanted to start this. Yeah.
More or less it will be a circular thing.
Yes, yes.
So do you have any particular machine to just take it out?
No.
Manually?
I'm talking about after death.
Yeah.
Yes. Manually.
But that perfect.
Because we are not worried about that round circle. After taking out this, we are going to put into the bottle with the antibiotic drops, and whenever we do surgery, we are going to take out only the cornea. So even आजू-बाजू का थोड़ा सा irregular होगा, तो we are not worried. Understood what I am saying? So if you take out full eyeball, naturally there is a big socket which is there, and then it doesn't appear good. But that time also we used to put some cotton swab, just like eyeball, ऐसा round करके we used to put it in area about 3 millimeter, and this cornea only is taken out. Why? Because disfigurement is not there. Disfigurement after the death. Many people are worried about that. Take out the eyeball. Sometimes it is little, those who are not, they might faint also, but there is no bleeding and all, so no problem. So very important point. We used to do this, which is easier, because this, even assistant doctors also can do this surgery. Little easier. But nowadays, what they do, only a part of the cornea and the sclera. 2 to 3 millimeter of the sclera. That means this white area. This white on the side, I cut one muscle. Again on the medial side, one muscle. Okay? Like that 4 muscles I am going to cut, and 2 more muscles I will be cutting afterwards. And then I will go behind like that. That means here instrument से ये optic nerve जो है ना उसको cut करूँगी. I have to go behind from here. I have to go like that behind, and I have to cut the optic nerve. Once I cut the optic nerve, I can take out the eyeball. So all the attachments of the eyeball, main is the muscles and the optic nerve, which I am going to cut. Is something attachment is there. You can't take out the eyes just like that. You have to cut something and then take out. Okay. Now if you see this eye, what I am going to do, cut the conjunctiva. There is a very thin transparent layer on the white part of our eyes. That is known as the conjunctiva. That I am supposed to cut all around. All around the corneoscleral junction. That means this black part is there and the white part. Just in that area I am going to cut it. Once I cut it, I get the sclera. ये white दिखेगा मुझे, ये white भाग है ना वो दिखेगा. This here I am going to make a cut. If I show here, I am cutting all around. This is a sagittal section. This is the surface. Once I cut it with one instrument, I will just go like that behind and then cut this muscle. Again I go inferiorly, I cut this muscle. Again there are other muscles. One is a lateral rectus and medial rectus, and other 2 muscles which are oblique. Not much in detail. I just want to know that the rectus on the side, the part superior rectus, inferior in the upper. Yes. AC should be on. AC should be on. So very important 3 things. Now once the doctor and the assistant will come to your place and they will fill up the form. Fill up the form and take the signature of the 2 witnesses. Family, friends. They will take the signature of the 2 witnesses and then they will take out the eyes. Now how do they take out the eyes? If you want to know, I'll just tell you.
How long time it takes? Within 5 minutes?
Hardly 5 minutes. Hardly. See, there are muscles here. There are muscles which are attached to the eyeball. There are about 6 muscles. And third very important is put off the fan. Because हवा की वजह से dryness होगा. Very important. 3 things important. Don't think of anything more. Only 3. After all, when you die, your body doesn't belong to you. Your body belongs to your relatives. So
there is no question of your agreeing. Family should agree.
That only. Even if you wanted to donate your eyes and if your relatives are not contacting eye bank or if they are not interested in contacting, तो तुम्हारा कुछ नहीं हो सकता है. But anyway, at least we are interested in donating. At least we have told our relatives, up to them to decide क्या करने का. Okay. So I think everybody should pledge their eyes for donation because there are so many people blind and they are actually waiting for corneal grafting.
Child blind, you can kill.
Of course. If the child has got a corneal opacity, I'm talking about a corneal. See, today we are going to talk. Yes?
The boom hole. Child is blind.
But child is blind because of what? Child is blind whether it's because of cornea. Whether child is blind because of optic nerve damage. If the child is born because of what? That is important, no? That is more important. So, you are supposed to tell your friends and relatives that you want to donate your eyes. This is important. Now, next. Whenever, suppose my father has told me that I want to donate my eyes after death. What am I supposed to do? Very important, after the death, you are supposed to close the eyes of that person. Okay? Close the eyes. At the most you can put some cotton swab, wet cotton swab on the eyes of the person. So that the cornea will not become dry. Why? Because cornea is important. Cornea is very important. If that becomes dry and then you can't do anything. So close the eyes, and second important, death certificate has to be ready before the doctor comes. Death certificate, you have to contact your family doctor and get the death certificate ready. Chalega. But important is your family members, they are supposed to know that you want to donate eyes. Huh?